Yeah, you're good.
They are? They look good?
Yeah, looks pretty good.
Okay.
Okay, so here's your ascending aorta, your aortic arch, and your descending aorta. Here's your brachiocephalic artery and your left subclavian. Because that's how it works on a cat.
Mhm.
And then we come up here and we can see that brachiocephalic branching. So we have the the right subclavian, there. The right carotid and the left carotid. Then we're going to follow the left carotid. And, oh, that's good. You still have your superior thyroid artery here, going to the thyroid gland.
Mhm.
And you have your muscularis artery here. We'll pull the digastric muscle back. Got a big lingual artery here.
Mm.
Just that real short piece right there is your external carotid, and that should branch. Okay, so we did have a bust right there. That one?
Mhm.
I think it went over here. Yes? See where it broke?
Oh, yeah.
That was connected to that.
Mhm.
So that would be, well, this is the parotid gland, so that little thing right there is the parotid artery, correct?
Mhm.
Okay, then your whopper size one, look at the size of that thing. That's the internal maxillary,
Mhm.
and then the external maxillary. Your external maxillary, external maxillary is this bigger one. I don't know that one.
You said last time that that was weird that it had an extra.
Did I say that?
Yeah.
So I don't
Where's
know.
the laryngeal?
Okay, so you still have it.
Oh, good. It's covered. That's
Yes, it's got connective tissue.
all right. So I got those two.
You do have it.
Laryngeal.
Yeah, you still have it. Okay, then I don't know if you'll be able to see this view because I can't even see it, but I see a labial coming right here.
Oh, okay.
Yeah, you can see it.
But I don't know. Let me push this back. About
Oh, yeah.
submental. Oh, you got a good view there.
Mhm.
Submental.
So this one is the submental.
The one going up. Yep.
Yeah.
Yeah, you got a good one.
Submental.
I knew it was
Well, your digastric was hiding it. See, look. See, that's digastric. So that when we bisected it and then reflect it, you can find stuff. So when you put digastric back down, you don't see much of anything, really. Yeah. Okay, so that was up the carotid. Just to make sure you guys know, you know all the parts of the mouth.
Incisors.
Incisors, right
Molar.
here.
Yeah,
Canines, molars, hard palate, way back here, soft palate. You guys have tongue, lingual frenulum. It's okay.
Can we do premolars, first molars, and second molars, or do you want them?
Molars, I don't care about that.
Okay.
Are any of you going into dentistry?
No.
Me either. Okay, so trachea, larynx. We already mentioned the parotid gland. And what did you guys do with your submandibular? Here it is. Submandibular gland.
My nose is running.
Now, I was telling you in lecture the other day, to find sublingual, we'd have to take all this musculature out.
Uh-huh.
So I don't want to do that. So we did find the submandibular and the parotid, and those are two salivary glands. Oh, another nice view of the esophagus here.
Mhm.
And yeah, it does. And we already mentioned the thyroid gland.
Mhm.
It's a good view of that. A good thyroid gland. Okay, over here we have the left subclavian. And then this is your internal mammary, and I'm going to pull on it. And then we see your VCT, vertebral, costocervical, thyrocervical. And then pretty much as soon as you can see, I've got the rib cage here. So that really is the end of the subclavian and the beginning of the axillary, because now I'm in my cat's armpit.
Mhm.
And then we need,
Oh, we were right.
you like being right?
Is that one that's subscapulary?
It looks like it's got to go down. A little bit of time right here. Okay, Casey, come look from this view.
See, that's what I was saying.
It's because it's big on this cat. Subscapular artery. Okay.
That sure is big.
Yeah. So really from about here to there is going to be the axillary artery. And then from here to the elbow is going to be the brachial. Correct?
Correct.
I'll get all this out of the way. Okay, then a minute ago I was just spending a little bit of time down here because your cat has really nice radial and ulnar arteries. Radial would be this one, of course ulnar would be this one branching off of it. Looks okay? While we're up here, let's talk veins because your cat's really good on veins.
Good.
Your cat has an external jugular here. Your cat also has an internal jugular. That usually doesn't fill with latex well with for the other cats, so that's why it's not on our list. But your cat has that.
Oh,
It's called the
okay.
internal jugular, external jugular.
Don't we have one jugular?
Yeah, external.
Right, okay.
And then this is your cat's subclavian vein. So you can see the jugular veins and the subclavian veins combine to form the brachiocephalic vein. Brachiocephalic vein and brachiocephalic vein combine to form the superior vena cava. And then we need something for a sternal here. There it is. Up there. Hey Chris, is your cat the one with the sternal vein that's still attached to the sternal the wall, the chest wall? Okay. Yeah. So if you look at Chris's cat and Paulina's cat, their sternal vein will still be attached right there.
Okay, cool.
But when we open it up, it broke. That's okay?
Mm-hmm.
All right. You guys know all the parts of the heart. And so your the veins coming out of your lungs aren't great. I think it was that cat over there.
Yeah,
Store
that
had
has
the
the
pink
good
ones.
ones.
Yeah. Let's see what your azygous vein looks like. Oh yeah, you got a
pretty
good
good.
one. Yeah, good azygous vein. You see that, Casey, right there?
Yeah.
So it comes up the right side. Right side.
Just right side.
And then most of the time then we roll to the left because the left gives us that really great view of the aorta and the esophagus.
Oh, yeah.
Yeah. So most of the time we spend with this view. And you can see the aorta coming down. There's the esophagus. All right, the little arteries that are coming off of the aorta to do the ribs are called intercostals. And then the little arteries that are coming off to go to the esophagus are called esophageals.
And you said you could taste us with the aorta up here or further
Oh
down?
man, all the way down. Look how far down. Aorta goes all the way to there.
Okay,
It
can
starts there, goes all the way down.
No, you already did, okay.
Yes? You guys know what a lung is?
Right.
Diaphragm,
Diaphragm, right.
So the
liver. Don't miss the easy stuff, right? What's that?
Gallbladder,
Gallbladder. What's this?
greater omentum.
Okay. This is top part of the stomach right here. Fundus. What's that?
That's
The lesser omentum on the
Okay.
lesser
And the-
curvature.
yeah.
Okay, what's this?
Greater curvature.
Okay, what are these?
Froggies.
Okay. What region of the stomach is this?
Oh, okay. At the top's the fundus, the bottom is the
Pylorus. Good, and you can see it constrict. There would be a sphincter there. See it constrict right there? So that's the end of the stomach. So what would this be?
that is the duodenum.
Duodenum.
I thought the duodenum was.
No, that's the
Well, the duodenum starts right
Oh,
here.
okay, yeah, that's what I was saying. Duodenum, then duodenum.
Yeah, so starts right there, ends about right there.
Okay.
Okay? And then what's this right here?
Pancreas.
Pancreas. That's good. Okay, so, oh, what's this?
spleen.
I don't know what that. Oh, our spleen starting to break.
Oh, that's
Come
lovely.
on, don't let us down, Cat. Stay together. Okay. This artery. Celiac. Okay, did you guys find the hepatic? Yeah, you did. Look. Hepatic artery. You had to reach in there and
Right,
grab it.
yeah.
It's because it's underneath there. It's
Mhm.
hiding. And then there's a lot of stuff there.
Yeah.
So, hepatic. How about this one? Gastric. How about that one? Splenic. That's good. What's this little bean? Adrenal gland. Okay. Ladies, we actually could do a little more cleanup here
Get
because
to
you
the-
found everything, so now you know that you can kind of break some of this connective tissue. See, look how much better that looks. What is that big artery right there? Superior mesenteric. Okay, then the superior mesenteric branches to make all of these.
Those are the
Intestinals.
intestinals.
What do you call this clear stuff?
Mesentery.
Mesenteric. That's good. Okay, got another artery right here.
That's inferior mesenteric.
That's very good. Inferior mesenteric. I don't know if you heard her.
Mhm.
Okay, and then it's a little weak, but I got an artery right there. It is weak, I agree. It's running all the way up the colon.
Oh.
Oh.
Dang it, where's my list? I can't remember.
It's running up the colon.
Is it the colic?
It's the colic.
And we just went over that one.
I busted that vein, sorry, but maybe you can see the colic a little bit better with that vein out of the way. The pink line.
Mm-hmm.
But it is a little weak. This one's not bad down here. This one that's going down.
Mm-hmm.
What's that one called?
Hemorrhoidal.
Superior
Superior
hemorrhoid.
hemorrhoid.
That pink one right there. Okay, so as Casey said, this is the inferior mesenteric, and then it's going to go up and make the colic, and go down and make the superior hemorrhoidal. Okay, oh, this is a good one right here. What's this?
Adrenal lumbar.
Adrenal lumbar. Now that's the artery. This is the adrenal lumbar
Vein.
vein.
Is that the phrenic? Right there.
Yes.
Okay.
And how would you know? Where's it go?
It's going
Up to the diaphragm?
Yes. Going to the diaphragm.
I'm looking through my phone right now, so I can't really.
Okay. Ellen's handling it. Casey's handling it for us. Okay, I'm just cleaning up a little here because, like Harley said a minute ago, we have to know the aorta all the way down the body. So I'm just making sure you guys can see that's still the aorta.
Uh-huh.
Just following the aorta right there. Okay, coming off the aorta right here, renal artery, and then the renal vein. And what would the renal vein drain into?
Inferior.
Vena cava.
That's correct. The inferior vena cava, just right there. Correct?
It's huge.
It's huge. Okay. So everybody knows what this is.
Mm-hmm.
What is it?
That's a kidney.
Okay. Like this.
The capsule.
Capsule. Now we're going to need renal capsule.
Renal capsule.
Renal capsule. Okay, how about now?
It's the renal cortex.
Renal cortex.
Medulla.
Renal medulla.
Renal medulla. Renal
Pelvis.
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 Good on the kidney? Okay. Oh, one more.
ureter.
Ureter. Okay. So we had a male.
Mm-hmm.
Just saw this laying here, so I figure, well,
Mm-hmm.
so we'll do something with that. What's this?
Test.
Testy. Okay, and then the testy has this thing.
Epididymis.
Epididymis, yeah. Could almost make it through. Let me see if I can.
I think we did the other one. Hold on. That's already done.
Use
The
it
other testing.
Yep. Now this one still has a covering on it. This one doesn't. What's
Oh,
the name
okay.
of the covering?
Geez. Jesus in heavens. Spermatic. No.
I have it somewhere.
Tunica
Tunica
albuginea.
albuginea. Are you filming me playing with this testy? Making sure. Yeah.
Ivan.
Yeah. So I just want to make sure you guys can see it's two separate things. That's why I put my probe all the way through. So this is the testy, and then there's the epididymis. Okay, 5 parts of the spermatic cord. What are they?
Oh,
Vas deferens, the autonomic nerve.
A nerve, yeah.
There's an artery
Artery,
and lymph.
lymphatic vessel, yeah.
And a vein.
And a vein. You guys okay with that? 5 parts of spermatic cord. So look how cool your cat is, because so this came through his abdominal wall, kind of like that. And then you're so good, you still have his testicular artery intact. You really still have his testicular vein intact too. It just didn't get any latex in it. See that
Yeah,
tissue
yeah.
right there? Yeah. And then you still have your vas deferens intact right there. So that's really good. Yeah, but didn't you guys do this dissection, the male dissection?
Yeah.
Yeah, you came in early.
Yeah.
Quick question. What is this tissue right here?
Mesocolon.
Mesocolon. That's good. Oh, you still have lymph nodes in it too. Super cool. What organ is this?
urinary bladder.
Urinary bladder.
So we have to call it urinary bladder?
Yeah, because we also have a.
Oh, gall bladder. Yeah.
Okay, so what's this tube right here?
Urethra.
Urethra. That's good. And did your guy have a little
Yeah,
hard
he does.
spot?
He has a
Yeah.
little one.
You can feel it.
Yeah, but you're right. It's not much.
It's not. They had the better one behind.
And then what
us.
are we feeling?
Prostate.
Prostate gland. Okay, what's the name of this?
Well, are you talking about the covering or the penis itself?
Penis.
Yeah. So you're just gonna write penis.
Penis. Okay.
What are you gonna write?
Penis.
Grant.
Shaft
Shaft.
of penis.
Oh, shaft of penis. Okay. Shaft.
And then if I pin here,
Glands.
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 Penis. Yeah, glands of penis.
Shaft of penis.
Shaft of penis. Glands of penis.
Don't get your penile parts messed.
Yeah, let's not call them balls.
No. Oh, she's recording it. Okay, what do you call this sac that the testicles were removed from?
Scrotum.
Scrotum. And what do you call the skin that we pulled back from the penis? That's what your patients call it. What are you going to call it?
Oh shoot, I don't remember. Gland shaft. Prostate.
Prepuce.
Prepuce.
Prepuce. Prepuce. It's the foreskin. Prepuce is foreskin.
All right. So back here. Everybody told me that was inferior vena cava. What's that?
Abdominal aorta.
And then what's this one?
Iliac.
Said the iliolumbar.
Iliolumbar.
Yeah.
And here it is on the other side. See it? Okay, how about this one? External iliac, good.
Internal iliac.
Internal iliac, and just dissect it out really well, ladies. Caudal. See, once you dig in there, it starts getting loose and it's easier to see stuff. You may remember your first day it was in there so tight.
Yeah.
So now it's easy to see that. Yeah. Okay, so then the external iliac goes into the leg, so now we call it the femoral. And what about this one?
That's deep.
Deep femoral. And then I'm going to pull and it disappears. There's a nice view. Look how big it is, Harley. See that? What is that? Goes into the back of the knee.